moved our vascular lab from Mayfair Place to Sunridge Plaza, and the main reason for this was to accommodate our same-day vascular surgery out-of-town patients. They used to be going down to Mayfair Place, they're now over the road from the PLC hospital, so it makes it a lot easier, more convenient for our patients to see their vascular doctor on the same day. We're just behind the Best Buy, opposite the PLC hospital and next door to the Five Guys restaurant. So it's just in Sunridge Plaza there. There is free parking for all of our patients outside the front of the clinic. There isn't a long walk to our clinic. You can literally park outside the front door and you'll be seen by us as soon as you arrive. We have a look in really great detail and we measure really significant disease. We look at post-interventions, so all of those that are performed by vascular surgery, so bypass grafts, angioplasties, stent surveillance, endovascular aortic repair, stents for the carotid arteries. This is all done in the vascular lab because everyone in the lab has really great experience with these particular studies. Depending on the family physician, they may decide that, a vascular ultrasound scan would help in my diagnosis of what's wrong with the patient. Every single requisition comes to us first in the vascular lab. One of our experienced and extra qualified members of staff will look at the requisition, see the appropriate test that's been marked for the patient and decide whether or not the patient's history and symptoms match up with that particular test. And because we're very specialised, we often get calls from family physicians to give them advice and give them instructions on which test would be the most appropriate for my patient with these particular symptoms. If we see a patient who has sudden onset of leg pain and we find a large blockage which is restricting the blood flow, this is one of the more urgent cases that we'd discuss with our radiologist on site. So we'd go to the radiologist, tell them what's going on with the patient, provide a detailed history, provide them the results of our scan, and depending on all of the above, the patient may be seen by the vascular surgeon straight away at the PLC hospital. With our results, legally we're not actually allowed to tell the patients the results directly. Our vascular interventional radiologists will do a really detailed written report. And because we are such a small team with relatively low numbers of patients, your referring physician will get the patient results within 24 hours.